Hello everyone, and welcome to the first module of the Whitebox Entrepreneur Support Program. My name is Victoria Nyakund, and I'll be your facilitator for today. I am a co-founder at the Kijiji. The Kijiji is an entrepreneur support organization that works with early stage businesses such as yourselves, and we support them through programs. For today's session, we will be covering business modeling, and we'll be sharing a tool called the Lean Model Canvas. And throughout this session, we will support you to build a one-page business plan. So at the end of this session, you'll walk away with a business plan in hand. So just to look at the objectives of this session. So the first objective is for you to get an understanding of what the Lean Model Canvas is exactly and how it works. And it's important that you understand how it works so that you're able to apply it to any future businesses or products that will be involved in launching in the future. So this is not a tool that you can use just for now. It's a tool that we hope that you'll be able to use even in the future. The other objective is also for you, as I said earlier, to create a one-page business plan using this canvas, and for you to walk away with it in hand. And having this business plan will give you clarity about how you want to run your business. So we'll get straight into it. And what you can see on the screen there is the Lean Canvas model, an empty one. And I'd just like to point out that, the Lean Canvas model is an adaptation of the business model canvas. So for those of you who've come across the business model canvas, also known as the BMC, the BMC and the Lean model canvas do exactly the same thing. They help you to sort of like lay out your business in a very simple and straightforward and structured way. The difference between the two is that the Lean Model Canvas has been adapted to make it more suitable for entrepreneurs, and especially early stage entrepreneurs. So if you put the BMC and the Lean Model Canvas like side to side, you will notice that there's some blocks that vary, but nonetheless they do the same thing. So when it comes to deciding whether to use the Business Model Canvas or the Lean Model Canvas, my thinking is that just use what suits you best based on the business model that you're running. Okay. So if you've already downloaded the Lean Model Canvas, if you could take it out so that you fill it out as we go along. Or if not, there's no problem. You can always just take down notes and transfer it to a business model canvas at a later point. Yeah, so we'll get straight into it and go into some quick tips on how you should go about this. So if you're just to sit down straight away and fill out the Lean Model Canvas, it should take you about 20 minutes. And the point here is that, you shouldn't really like overthink things. So you should be able to just like put down your initial thoughts and then get back to it and refine as you move along. And it's okay to leave some sections blank. As we go through the Lean Model Canvas, you'll realize maybe there's some aspects of your business that are not entirely clear to you. So rather than sort of waste time overthinking and deliberating with yourself or with whoever you're doing the Lean Canvas model with, just move on, finish it, and then you can always get back to it. So it's fine to leave some sections blank. It doesn't all have to be full. The other quick tip would be to think in the present. So think about it in terms of, based on where my business is at now, what do I need to do? Or what are the things that I need? What are the steps that I need to take to make progress and move the business forward right now? And then the last one is to use a customer-centric approach. So really put yourself into the customer's shoes as you go through the Lean Model Canvas, because at the end of the day, these are the people that you want to be serving. So try as best as possible to remove yourself as the innovator or the entrepreneur from the equation and constantly work to think from the customer's perspective. All right. So getting straight into the first blocks, which is the problem and the customer. So these two blocks are sort of taken together because in identifying the problem that you want to solve, you need to know who it is that you're solving for, and that happens to be your customer. Lack of clarity of the problem that you're solving is actually one of the biggest factors that contributes to the failure of startups. So, you find an entrepreneur that's very excited about this product that they're building. They know it's going to do a lot of good. They put a lot of time and resources into it. And then when they finally take it into the market, it doesn't take, because it's not solving a problem for anyone. It's not solving a pain point for anyone. Nobody really wants it or needs it. And so when you're thinking about the problem, it really helps to think about it from the customer experience. What is it that the customer is experiencing right now that you want to solve for them? So essentially, the question that you're looking at should be, what pain or need is the customer experiencing? Not what pain or need do I think the customer is experiencing. Also, in thinking about the problem, the lean canvas prompts you to think about how the problem is currently being solved. So for many of us, when we are working to build up our startups and businesses, whatever problem it is that we're tackling, it's more likely that there's another company already sort of working to solve that same problem. So there already exists like alternatives that the customers are using. And alternatives here could take the shape of competitors or just other tools that the customers have figured out for themselves that they can use, right? Yeah, so I would just like to sort of put this into perspective and give you an example, right? So the business that I'm going to be using like throughout this whole presentation is a business that I'm involved in running. It's called Olivelink Healthcare Limited. So the founder of Olivelink Healthcare Limited was working as an administrator in a level 4 hospital. And during her time as an administrator at this hospital, she realized that there were some expectant mothers who are coming from a particular slum area, which was about 7 kilometers away, which is actually quite far. And they were coming all the way to this level 4 hospital to be able to get maternity services. So this really piqued her curiosity, and she was wondering, why do these women come so far to be able to get maternity services? And so when she went on the ground, she was able to identify that the problem was that these women were looking for good quality services that were not expensive, so low price, and they were also looking to be treated with dignity, because of course the birthing process is intense, so you also need someone who has that patience to take care of you during the process. And so this became the problem that they identified. So as you can see in the model canvas that I have on there, the problem was lack of good quality, affordable, dignified maternity services. And when the founder went onto the ground, she realized that existing alternatives were the City Council Hospital, which is also called Mareba. There were other private clinics and hospitals, and the other option was also the traditional birth attendants, in short called TBAs. So this is what she was able to see as the problem, and she was able to identify the existing alternatives. So in this case, I would like for you to take some time and to think about what the problem is that your business is solving. So ask yourself, what pain or need is my customer experiencing? And if there's more than one, that could you could also put those down. And what are the existing alternatives? How are those problems currently being solved? You can pause the video here if you'd like to be able to fill out your canvas. So the next section that we're going to be tackling is your customers. So of course, as you know, customers are the lifeline of a business. Without customers, you have no business. And the truth is that not everyone is going to want the product or service that you're offering. And in some cases, even when you're building for the mass market, as you start out, and especially because you have limited resources, it's important for you to be able to target your efforts towards a specific customer segment. So when you're thinking about your customer segment, it's important to differentiate between who's a customer and who's a user. And while in some cases the customer and the user is one and the same, in some cases that's not the case. um, so a customer is the one who pays for your product, while a user obviously is the one who uses your product. So if, for example, you think about if you have an educational app, let's say, that offers tutoring services for maybe class 8 candidates, for example, you'll quickly notice that your customer becomes either the parent or the guardian that will actually pay for access to this app. And your user then becomes a 13 or 14-year-old teenager who probably has a challenge with some subject or other, and they're looking for help with that. So yes, it's important to be able to define who your customer end user is, because your strategies on how to acquire them will be different. The other sort of tip I would give when you're thinking about your customer segments would be to start with broad assumptions and then narrow down to specifics. And to enable you to narrow down to specifics, you could use factors such as, age, location, gender, profession. And this is the process that's called market segmentation. So I'd like to give a really quick example with a local product called Mandevu Beard Care. So obviously from the get-go, when you hear Mandevu Beard Care, this is a product that helps those who have beards to take care of them. And, from the get-go, it quickly becomes obvious that the people that you're targeting are the male gender, not the female gender. So you really start to segment based on gender. And if you want to segment it further, you could think about it in terms of at what age do people start to grow beards? So in this case, maybe, anybody below 20 probably doesn't have a beard. And you could, put it at a cap of maybe 60 to say that, anybody above that would probably not be interested in a product like this. So you narrow it down by age, and then you say, you're looking at male gender between the age of 20 and 60. And you can narrow it down further and say, based on the pricing of this product, probably someone in university would not be able to use this product. So you're probably looking for professionals, and these could be bankers or they could be models, So you narrow it down by profession, and then you sort of have for yourself a customer segment that you can start to actually target. Okay, so that's what segmentation looks like. And the other way to sort of start to figure out who your customer segment really is to just really go out there and talk to people. Talk to those who you think are your customers, and test your assumptions and see if you're actually right, or if you sort of need to go back to the drawing board and rethink about who your customers are. There's another special segment of customers who are called early adopters. And early adopters are really useful because these are the people that will help you to validate your product earlier on. And in most cases, when you're trying to figure out who your early adopters are, it helps to think about who are the people that are suffering the most with the problem that you are looking to solve, right? And think about it in extremes. Who are the people who, for example, will, lose their job if this problem is not solved for them, or maybe a life will be lost if this problem is not solved for them, that kind of thing. So you get to really figure out who are the people who this problem, it's really paining them. It's really, they'll take any solution that's going to offer them, some relief, they will take. That's why they're called your early adopters. Okay. So with regards to Olive Link, they were able to segment their customer, and they were able to determine that, they were looking at expectant mothers, so women of childbearing age between the ages of 20 to 45, living within informal communities and on the eastern side of Nairobi, right? And for them, their early adopters, they chose the early adopters based on where exactly they were located. So the expected mothers that they were targeting were those that were based within industrial area, specifically in an informal settlement called Viwandani. Okay. All right. So I would like you to probably pause the video here and to think about who your target customers are and who your potential early adopters would be. Feel free to pause here. I'm just gonna go on. So the next sort of block that we'll be tackling is the solution block. So based on the problem that you've been able to identify, how will the product or service that you're planning on offering solve these problems for your customer? So here you're really asking, is there a problem solution fit? So earlier on, when we were looking at the problem and we posed the question, what pain or need is the customer experiencing? When we are looking at the solution, we're looking at how can my product or service solve that problem, okay? So going back to Olive Link Healthcare, they chose to deliver their solution, which was good quality healthcare services. They chose to deliver that, through a community-based clinic that offers good quality, low price, dignified maternal healthcare services. Okay. So in your case, I'd like you to take a few minutes to fill out your canvas and to look at what is the solution that you've come up with to solve the problem that your customer is facing. So keep in mind the problem and let it be clear for you what the problem solution fit really is. Okay. You can pause here if you'd like to. So the next block that we're going to be looking at is the unique value proposition. And this is described as a single compelling statement that says why you are different and worth buying. So what is it that you will do differently, and how do you stand out from the crowd? You do not essentially have to have this right from the very beginning. You can refine it as you progress in your business. And unique value proposition could take shape in terms of, let's say, your product, it has a better performance, right? Or whatever service it is that you're offering is easily customizable to the needs of your customer. Or maybe you're competing on pricing, so you have better prices. Or maybe your product is just more conveniently available or accessible. Or perhaps it is that your product has superior design. So essentially, this is a statement that convinces customers to come to you rather than to go to your customers, all right? So a few quick tips to guide you on how to think about your unique value proposition. it first of all needs to be clear and really easy to understand. If someone needs to read it in 5 seconds, they'll be able to get it and be like, yes, I understand what value is being offered here, right? That's one. And then the other thing is, be specific about, the results or the value that the customer is getting from purchasing or using your product or service. The value proposition should also explain how your product or service is different or how it's better, right? And in some cases where possible, you can use visuals to actually put your message across, because pictures speak a lot louder than words, okay? So I would like to offer here just a suggestion. So I was able to come across a format on how to formulate your unique value proposition from a program that I participated in earlier this year. And I found that, their suggestion was quite clear and straightforward. It didn't require too much thinking. And so this is what I would like to offer to you. And this is just purely a suggestion. And it's a starting point, and you can always refine it as you go along. So still taking into consideration Olive Link Healthcare, for your target user. In this case, it's expectant mothers in urban informal communities, right? And what they want or need. So what these expectant mothers are looking for, they're looking for high quality, low price, dignified maternal services, healthcare services, right? And the product that Olive Link Healthcare is offering is a hospital that provides good quality, low price maternal healthcare service. So this essentially is, the reason why these mothers should come and buy from Olive Link Healthcare, should come and seek services from Olive Link Healthcare Hospital. Okay, unlike the competitors around. So we have surrounding public and private facilities that offer low prices, yes, but do not focus on quality or offering a dignified service. Okay, and just a primary statement of differentiation is that our clinics provide high quality, low cost, empathetic, sensitive, and dignified maternal healthcare services for expectant mother in urban informal communities. So in looking at this as a statement, it could look something like this. For expectant mothers in urban informal communities, Olive Link Healthcare is a hospital that provides good quality, low-cost maternity healthcare services, right? And so on and so on. So you could take this format to sort of help you put down your thoughts really clearly. It may be a bit repetitive in some way, but at the end of it is just for you to be really crystal clear, or to start to gain clarity on what your exact unique value proposition is. Okay, and so as you can see, we're really filling out our lean canvas. So I would like to give you this opportunity to pause the video and to craft or start to figure out what your unique value proposition could start to look like. Feel free to pause the video here. I shall carry on. So the next block that we're going to be covering is channels. And when thinking about channels, I think about it in sort of two distinct ways. So the first one is how you reach your customers to make them aware of your product or service. So it could be print ads, word of mouth. Social media platforms are really popular these days. It could be like flyers, promotional events, and the list goes on and on and on. So that's the first way to look at channels. That's the first consideration to make when you're thinking about channels. And the other consideration is about how easy you make it for your customer to get your product or service. And there are two questions here that you need to take into consideration, which is one, whether you have a physical product or a virtual product, right? And two, whether you're going to sell it directly, so through boots on the ground, or if you decide to put up your own digital platform, or if you're going to sell it indirectly, so through maybe retail stores or third-party distributors such as Jumia or Kilimall or the more globally known Amazon, right? So that's how I would recommend that you think about channels. So in two ways. One, it's about how do you make your customers aware about your product? And two, how does your product or service reach your customers? Okay. So in the case of Olive Link Healthcare, um, they chose to create awareness within the community by the use of community health volunteers. And they also employed flyers and put up free medical camps just to get the word out into the community about the services that they were offering for expectant mothers. Okay. Um, and the way in which they chose to deliver their services to the community that they were targeting was to set up clinics right where their target market was based, so that the expectant mothers could easily access the maternity services. All right. So here I would like you to think around how you're delivering your solution to your target market. So how you're creating awareness, as well as how your product or service is reaching your customers. You can pause the video here if you'd like, but I'm going to move on. So the next sort of blocks that we'll be covering is, the money aspect of your business. So here we're looking at the cost or expenses, and also how you're making money. So how money is coming into the business. So when you we'll start with the revenue streams. So when you're looking at revenue streams, revenue comes from what a customer pays you for your product or service, right? And these can be of two distinct types. So one is transactional, so a one-off payment. So for example, what you'd pay for, like if you're purchasing a house or a car, those would be like transactional, so one-off payments. Or the other kind of revenue could be that it's a recurring revenue. And this we find with subscription services such as DSTV, for example. So in my experience, I found that, startups are a little anxious to charge for their product or service at the beginning. And, to some extent, it's understandable, because the feeling is usually, my product is really raw. Will anybody really be willing to pay for it? My perspective is that if you're planning to charge for a product, and you should be, because you're doing a business, you're not running a charity, it would be wise to charge it from the very beginning, right? And by charging from the very beginning, it also means that you get to test a really risky aspect of your business, which is about whether people are willing to pay for the solution or product that you are offering, right? So if this raw product is really answering to a customer's pain point and it's offering value, then that value should be monetized. Okay. So when we come to look at our costs or expenses, they are two sort of groups here. So it's either fixed costs or variable costs. So fixed costs remain the same no matter what. So if you're if maybe you only get one client for a particular month, or you only sell one product, you still have to pay any HR, you still have to pay any rent for rent. Or if, for example, you're hosting like you have your service or product on a platform, then you still need to pay for those hosting services. So these are the expenses, the business expenses that do not change and remain constant. The business incurs these expenses whether or not you make a sale. Yeah, the other type of cost to consider are variable costs, which vary depending on the level of activity in the business. So here we are looking at, for example, cost of input. So if on one particular month, maybe you manufacture 11 products, 11 units of a product, and on another month you manufacture 100 units of a product, then the inputs there will be the same, and the cost of the inputs will also vary, of course, because one will be higher than the other. Okay, so going back to our Olive Link Healthcare business, when we're looking at revenue streams, they had two particular revenue streams. So one was they were charging cash for their maternity services. So women would come seeking maternity services and would pay cash for services rendered. And the other was through NHIF. So in some cases, women came and they were being paid for by NHIF to be able to get maternity services. So the revenue streams for Olive Link Healthcare were these two. When it came to the costs and expenses that they were incurring, it was around rent, medical supplies and medicine, and of course, the medical personnel offering the maternity services. So feel free to pause the video here so that you can think through what your revenue streams look like and what your expenses or costs look like for your business. The next block that we are going to be looking at is with regards to key metrics. And when it comes to key metrics, what we are looking at here is what are the key indicators that you need to keep track of to know if your business is working or not, right? As I said before, when starting out, you have limited resources at your disposal. And so it's important to maximize on what you can do with your limited resources. And that is why it's important to really keep track of the aspects that drive your business. And some examples here could be, you track like the number of customers. So if last month your number of customers was low and this month your number of customers is higher, then you need to know what is it that you did differently so that you keep repeating, right? And if it's vice versa, then you'll also be keen to figure out what is it that changed. What is it that we should stop doing, right? You could also keep track of, revenues. You keep track of expenses. You could also keep track of things like, what it costs you to acquire a customer, for example. So based on the kind of business that you're doing, just be able to think about what are, the factors or what are the key metrics that you need to keep an eye on so that you're able to know whether your business is progressing or not, right? So going back to, Olive Link Healthcare, the key metrics that we were keeping track of were, first of all, the number of mothers. So if the number of mothers changes from one month to another, that's a very, we need to be able to see what has happened. So for example, in some cases where you find like the nurses are on strike, it means that maybe at the city council hospital that's not too far from where we are, it means that they are not working. So we'll find that we have an upsurge in terms of number of mothers who come to seek services from our clinic. We also keep a close track of the cost of delivery per mother. So we do have an average, but in some cases where mothers come and they have maybe like complications, of course, the cost is higher. But also for those mothers who are catered for by NHIF, we keep track of those costs so that we don't go overboard in terms of what it takes to cater to a mother, right? So feel free to pause the video here so that you can think about what the key metrics of your business are. So the final block that we're going to be looking at is what is called the unfair advantage. So a real unfair advantage is something that cannot be easily bought or copied, right? And the truth is, as you start out, you may not really be able to pinpoint what your unfair advantage is at that particular point. Um, Unfair advantage usually becomes like clearer as you sort of progress with your business, right? Um, but just to give you an idea on what it could look like, right? So it could be that you have access to insider information. Uh, Insider information means this is, information that very few are privy to, um, and nobody else has access to it. So it's information that very few people have, right? That could be an unfair advantage. Um, the other way an unfair advantage could look like is that maybe you have a dream team. So you have put together a unique group of people with a very high caliber of expertise, and that's what really, puts you above all the rest in the market. It could also be that you're a personal authority or you have expertise in a very unique area of work, right? That is key to your business. And so because you're a personal authority and you have all this knowledge about that, that area of work, and it's something that you've taken years and years and years to gain, it's not something that someone else can easily, buy or copy, right? So that makes it an unfair advantage. It could also be that you just have like a customer base, an existing customer base that you could leverage on if you're looking to sort of offer a new product or service, right? So an unfair advantage is usually, a little tricky to figure out, and that's why it's left as the last one. And in some cases, some businesses just don't have an unfair advantage, and that's okay. But it sort of does put you a step above your competitors if you're able to identify what your unfair advantage is. Okay. In the case of Olive Link Healthcare, my view is that they do indeed have an unfair advantage. And the unfair advantage that they have is the fact that the founder of Olive Link Healthcare had been working in management in the banking industry for 18 years. And so she was able to take that experience and take that into the management of, healthcare. And this actually, in my opinion, has put her above the rest because she understands about, managing managing businesses, managing employees, managing systems. Like she understands all that, right? In most cases, when people have set up clinics, they are usually they've usually studied, medicine. So it's either a nurse or a doctor or a clinical officer. So they have the medical part down, but they are lacking in the management side, right? So in this case, the founder of Olive Link Healthcare, really is strong with regards to the management, and she's been able to get on board, employees that have the medical expertise which she pays for. So I don't know whether you'll agree with me, but to me, that really is an unfair advantage as far as Olive Link Healthcare is concerned. Okay, so there we have it, the lean canvas model for Olive Link Healthcare. I'm hoping that, you guys uh, um, can also take the time to think about what your unfair advantage is. And, there's no pressure around, to think about it or to figure it out just now. It can become clearer with time as you go on. Uh, that said, I would like to thank you for listening in on this webinar. And yeah, I wish you all the best in your entrepreneurial journey. Goodbye.